So I think most people who are doing innovation wonder, if I came up with an idea in the beginning, is it actually going to end up going somewhere so that it can help patients? Well, we come up with lots of ideas when you start the innovation process, and great ideas don't necessarily all become viable solutions. It takes a lot of work to get there. So the idea is really more of that light bulb moment, something that you think of kind of in the moment to help solve a problem. But a solution is really a fully developed answer to a problem that's validated through prototyping and testing and real-world application. So it takes a lot of work to go from an idea to a viable solution. Like we talked about earlier, remember to keep an innovation mindset to help you identify which ideas will work and which ones won't. And remember that invention is driven by ideas, while innovation is driven by insights. Let's hear from our guests about idea validation.
When evaluating an idea for commercialization, several factors come into play. First off is the unmet need. The idea must address a significant unmet need in the market or the field. Second is the scientific validity. The underlying science must be robust and reproducible. The third is market potential. Although I don't focus on this as much early on in the conception of a project, there must be a viable market for this product.
There's different criteria for when something is publishable versus when something is of interest to an industry partner or an investor. That could mean additional validation steps that maybe we weren't aware of until we got feedback from industry. It might be identifying the right indication depending on what the market trends might be at any given time.
So there are certain characteristics about an idea that can really help make it successful as a commercial solution. Let's hear a bit more about prototyping and testing from our experts.
Starting out with a low fidelity prototype, getting that low fidelity prototype in the hands of your end users in the environment where the problem's taking place so that they can give you real-time feedback on what works, what doesn't work, what they'd like to see, questions they have. It really is all about usability, and then taking all of their feedback, refining it, and doing the process again. That human-centered design process is all about iteration.
For things like medical devices, where you're actually prototyping a device, it's very hard for us to file a patent application before we have some kind of design in place, some kind of key mechanical understanding of the device. It doesn't necessarily mean a full-on prototype, but at least the beginnings of a design and understanding what the mechanical benefits or the electronic benefits of the medical device are in order to file a patent.